This video is about Orthoptek, a revolutionary new treatment for amblyopia. Amblyopia is also known as lazy eye, and it is a very common disorder that affects almost 3 to 4% of children. It generally occurs when one eye is weaker than the other. It can also happen in the case that one eye has a slightly more spectacle number than the other eye, or if both eyes have a spectacle number, which makes it difficult for the child to see and can lead to unequal development of both eyes. Up to now, the current treatments that were available for amblyopia included patching of the eye, where one eye was patched and the other eye was forced to see generally the weaker eye, which was quite uncomfortable for the child. And the main drawback was that after about 12 years of age, these kind of treatments would not really work for the child. Also, certain drops could be put in the eye, trying to blur the better eye while the weak eye was forced to see well. Orthoptek is a revolutionary new therapy for amblyopia, which approaches the problem of amblyopia from a completely different way. In amblyopia, the brain and the eye do not work well with each other. Even though the signal from the eye of vision is being sent by the eye to the brain centers are not able to process these signals to generate vision. Orthoptek tries to solve this problem by stimulating the brain centers. This stimulation of the brain centers is done by showing a number of flashing LED lights in front of the child's eye. Exact instructions on how to perform this treatment are shown in the next slides.
In the first part, the patient has to look at the light but follow the peripheral lights as they come on. These peripheral lights come on for about 300 milliseconds. The patient starts with the better eye while the weaker eye is covered, and he performs the exercise for 2 minutes. After that, the patient covers the better eye and performs the exercise with the weaker eye for about 20 minutes. After that, both eyes are open and the exercise is performed for 5 minutes. This concludes the first part of the exercise. In the second part, the patient has to again look at the central red light and not move the eye from there. The peripheral lights will come on and go off randomly, and the patient has to count the number of times he sees the peripheral light while he is looking at the red light. So he first does the exercise with the weaker eye and counts peripheral lights up to 400 times. He then does the exercise with the strong eye, covering the weak eye, and he counts up to 200 times the peripheral lights coming on. And then he opens both eyes and counts the peripheral lights for 200 times. That concludes the second part of the exercise. Each session lasts for about 40 minutes, and you should note that the number of times that we ask the patient to count the lights would depend on the severity of amblyopia.
Thank you for your attention.